The Watchman device is a percutaneous strategy for occluding the left atrial appendage to prevent strokes. So there are a number of studies, the PROTECT AF study, the PREVAIL study, and the CAP AF study, which have all shown that the Watchman device actually does pretty well, and it reduces the incidence of stroke, and it works comparable to oral anticoagulant strategy. So I think the answer is yes, the Watchman device will be a good strategy to prevent stroke in a subset of patients who are not eligible for oral anticoagulant. It doesn't take care of the atrial fibrillation per se itself, but it does reduce the incidence of stroke in these patients who can't take anticoagulant medications. So, I think we all recognize that the pulmonary veins and pulmonary vein isolation is the cornerstone for treating atrial fibrillation. So I think if we find that there are other triggers that we need to proactively take care of, we might start performing more extensive ablations, which I think, if we need to do that, we certainly can do that, but we need enough data before we start burning more tissue in people's hearts. The big picture view of AFib is to really kind of try to prevent atrial fibrillation rather than treat it. And I think upstream strategies are going to be more important and need to evolve more aggressively as compared to downstream strategies. So when I started off by saying that lifestyle modification, really changing the metabolic milieu of the body so you can prevent atrial fibrillation, I think is really an important strategy to focus on. So a lot of efforts are going in that direction. Obviously, antiarrhythmic drug therapies have been limited. They're there, they provide supportive care, but none of them are elegant enough that they're curative. Ablation strategies are doing really well. I think there's been an evolution in the treatment strategies. There are different energy strategies that we use. We use radiofrequency as well as cryoablation, and now there's even laser approaches for pulmonary vein isolations are evolving. So there's a whole slew of ablative strategies that are evolving at this point in time. Eventually, I think it's going to be a combination of efforts of really trying to prevent it, and in the ones you can't prevent it, then treating them strategically with catheter ablation in a potentially individualized fashion, not in a one-size-fits-all approach that we use at this point in time.